Afternoon. Thanks for having me this afternoon. I come to you from Sydney, from Royal Prince Alfred Hospital in Australia. Before I begin, I'd just like to acknowledge my co-authors, Jason Danaway and Oliver Enke as well. We have no declarations of interest. So as many of you know, up to 20% of patients who undergo total knee replacement are dissatisfied after the operation. And many of these patients undergo further evaluation to identify a cause, but a number of times a cause for dissatisfaction is not identified. As we've already heard about today, there are a number of known indicators of outcome, and this, along with X-rays, influence the selection of surgical candidates. Unfortunately, the relationship between radiological severity and outcome after total knee replacement is a little bit unclear, with variability amongst the studies and the literature. So our aim in this review was quite simple. We wanted to look at the association between preoperative grade of arthritis based on X-rays and the association with postoperative pain, function and satisfaction after the operation. So we conducted a pre-registered systematic review. We conducted it in accordance with PRISMA guidelines, and we searched the major databases up to November of last year. We included prospective and retrospective studies, those with a minimum follow-up of 6 months, all classification types of osteoarthritis, studies reviewing clinical outcomes based on preoperative grade of OA, and studies that reported total knee arthroplasty data together with other arthroplasty surgery. We excluded those studies with patients who'd had osteotomies or prior surgery of the knee, studies including only bilateral surgery, studies that included more than 10% of diagnoses other than primary OA, and studies that did not include preoperative data. So following the search and review process, there were 20 studies that were included in our review. So the results. So in total, 20 cohort studies were included. There were 7,478 patients that we reviewed. Most of the studies achieved an acceptable quality assessment score based on the Newcastle-Ottawa scale. Most of the studies reported the preoperative grade of osteoarthritis based on Kellgren and Lawrence. And as you can see there was a lot of variability with patient-reported outcome measures used between each of the studies, which made it difficult for analysis down the track. This is just a really simple table summarising our findings from all of the studies. We found that 10 studies reported statistically significant results favouring those with worse preoperative OA in terms of pain improvement. Similarly, for various aspects of functional recovery, there were 6 studies that reported statistically significant results favouring more severe preoperative osteoarthritis. I guess the other thing to comment on, there were no studies that found results favouring less severe osteoarthritis. Some noteworthy findings from particularly well-conducted studies. So Dowsey in 2012 found that those with grade 4 were 4.8 and 3.5 times more likely to have moderate to severe pain at 12 and 24 months compared to those with grade 3. With regards to function, Khan in 2013 found that the higher preoperative KL grades were associated with better postoperative WOMAC total and disability scores. And Schnur in 2013 found that compared to grade 4, the risk for dissatisfaction was 2.5 times higher for grade 3 and almost 3 times higher for those with grade 2. As I mentioned earlier, the data heterogeneity and outcome measures limited our ability to do a meta-analysis, but we did do it on Knee Society score outcomes for 3 studies. There were 794 patients in these studies. What we found for pain is that there was a statistically significant result favouring those with grade 4 compared to those with less than grade 4. We also reviewed function, but the results were similar between the 2 groups. So just to talk about some of the strengths and limitations. So we used a priori protocol with pre-registration. We had a detailed inclusion criteria, we duplicated key steps, and we utilised a librarian to assist with the search process. We're limited by the initial title and abstract screening being performed by one author, inclusion of retrospective studies with inherent weaknesses, heterogeneity of data, limited meta-analysis, lack of objective outcome measures, and the use of single algo-functional outcomes data such as the Oxford Knee Score and WOMAC, so we couldn't differentiate between pain and function outcomes. So what we've found is that X-ray severity of knee osteoarthritis is a determinant of outcome after total knee replacement. However, we acknowledge it is one amongst several contributing factors, and the strength of association remains unclear. So as I've mentioned, more severe preoperative radiographic OA is associated with better pain, function and satisfaction outcomes. The difference is more obvious for pain than it is for function, which was supported by meta-analysis. And third, further research should be aimed at assessing the association between the known determinants of outcome post-total knee replacement, including radiographic severity of OA. Thanks very much.